Hello, I'm Shannon Brinker, and this portion of our learning module for the Chairside assisting is called Retraction and Evacuation. It is the dental assistant's responsibility to maintain a moisture control and keep a clean environment for the patient and for the doctor. It is really important for us to also understand that we are responsible for keeping the patient's mouth free of any excess saliva, chemicals, blood, fragments, or any other dental materials. Common procedures that use dental moisture control techniques are teeth cleanings, fillings, indirect, direct restorative, and even surgery and root canals. The different moisture control techniques we're going to talk about today will involve evacuation systems and making sure that we are again, taking care of the oral cavity and keeping all the teeth clean and isolated. As a dental assistant, though, you will become familiar with all of these procedures. And most importantly, today we're going to give you a lot of different options with the materials that you can utilize really well in your hands. The first thing you want to think about are what are all the advantages of the products and the equipment that we're going to be talking about. The most important thing is that we're protecting our patients, and that is so important. We also want to make sure that we understand that our main role as a dental assistant is to really keep, again, that visible, accessible, and comfortable area for the patient, but most importantly, providing a very organized and efficient operating zone for the doctor. We want to make sure that the fluids do not interfere with any applications of dental materials, and now we know in dentistry how important it is to keep the saliva away from the working field. There are no fluids or materials for the patient to swallow or, most importantly, aspirate, and no interferences with the manipulation of any handpieces or instruments being utilized by the operator. We also want to make sure that we're not the reason why we're taking more time. Our job as a dental assistant is to make the dentist procedures or the doctor's procedures more efficient and less time consuming. We also want to make sure that, again, the number one job of the dental assistant is to make sure that we're taking good care of the patient. And we never want a patient to complain about us. So when you're a new assistant, the most important thing to do is to keep the patient's mouth clean and, most importantly, free of any debris. Today, we're going to talk about a lot of different procedures, but most importantly, we don't want you to get discouraged. I've been a dental assistant for 30 years, and it's really important to know that, I've done my time, and it took a lot of time for me to really feel comfortable, but most importantly, be able to understand your doctor. Every doctor is different. So anytime that you're working with a different dentist, it's almost like starting over again because every doctor is very, very different. The procedures are very different, but one of the things that we've talked a lot about is everything in dentistry is repetition, from the restorative procedures to the endodontic to the periodontist. When we think about ortho procedures, aligner placement, sealants, anything that we're doing in dentistry, it is going to take time for you to know the procedures, the products, and most importantly, knowing the doctor. Especially as we've talked about in the other modules, a right and a left-handed dentist. Don't think again that this is something you're going to get on the first day. Every dental assistant, no matter how long we've been assisting, is going to have the same issues regardless because of the fact we haven't learned our doctor yet, and you will, trust me, it will come. So the first thing that we want to talk about in regards to isolation is sometimes patients are given a prescription. The doctor who may have a patient who has a lot of excess saliva may decide to utilize drugs to help with that when it comes to doing longer appointment times. And sometimes they will give this area of medication, which we'll talk about later on in the charting on, sometimes rare indications of prescriptions are needed. These prescription drugs will basically dry out the patient's mouth. And so, again, that's why we're utilizing these types of areas of again, drugs. So don't think that most doctors use this, because they don't. A lot of times this is for those patients where they're going to be sitting in the chair anywhere from 4 hours to 6 hours. And it just helps not only lower the anxiety, but most importantly, dries up those saliva glands. Now, when we get into the retraction and the suction, there are so many devices. And today I'm going to try to give you as many as we possibly can. But again, there are so many different products released every year, we can't keep up. So what we're going to kind of go through is just give you what you're going to see in every ordinary practice. And then towards the end, I'm going to share with you some products, because if we know as a dental assistant, if we can help your life be easier, I think that's the beauty of an assistant putting together these learning modules for you, is that we have already walked the walk, right? So what I want to do is, not give you all this fluff, but really give you what you need so you can start assisting right away. And so we're going to first talk about cotton roll isolation, which is just, again, everybody's utilizing cotton rolls. Some evacuation devices as far as high volume suction and what we call our saliva ejectors, and then utilizing throat shields and mouth props. So let's get started. The one thing that we want to mention today are, why are we utilizing so many products and materials to help with retraction? Well, the most important reason is because we know that in dentistry, there's always going to be accidents and things are going to happen. We're all human and we have no control over everything, although we wish we could, right? So one of the things that we know now in dentistry is we are taking more precautions. But the great thing about being in dentistry this day and age too is there's so many new products coming out, and we are constantly seeing new items coming from manufacturers to help our lives and make it easier when we think about any patient, ingesting any piece of equipment or aspirating any dental instruments, and most importantly, looking at those areas, because the last thing we want is for a patient to swallow a clamp, a file, any type of equipment that we're utilizing for placing implants. But again, if these things happen, one of the things that we have in our charting module are steps when we have emergencies and what do we do. But most importantly, as a dental assistant, we have to be on our toes and aware. Even if the doctor is working, it is always our job to not only keep the patient's mouth clean, but most importantly, looking out for these little pieces or things that are happening at all times, to really making sure that the patient does not swallow or aspirate any restorative items inside or outside of the oral cavity. The first thing I want to talk to you about is probably one of the number one things that we will get to know and utilize every day on a daily basis are choosing cotton rolls and, helping us to make sure that we are keeping the saliva glands as dry as we possibly can. These cotton rolls will be basically an item that we would place underneath the patient's tongue, in between the cheek, and utilize for isolation during so many different procedures, from sealants to cementation, to any type of indirect restoration preparations. These are just something that you're going to see from the very first day you become a dental assistant. There's all different types and brands, and I have my preference. As a dental assistant, you will have yours as well. But the most important thing you want to look at is absorbency, and there's so many different brands. And I will say that, I here have Richmond Dental cotton rolls. I really do love utilizing their products. There's a lot of other ones out there. This one is just tried and true to me, and I love the fact that it's family owned and operated, very durable, and different types here. You'll see that the one that almost looks like a hair braid, they call this braided cotton rolls, but there's also some that aren't, and they're just a standard cotton roll that we utilize in dentistry that really is just wrapped and really tight together. The one thing about a cotton roll, though, is that it is very flexible and provides a really secure fit. Again, when we're placing it underneath the patient's tongue or in between the cheek area. And sometimes, again, when we're going to talk about later on in this module, is exactly where are they going to be placed. So let's talk about that just for a little bit. On the maxillary arch, we talked about going in between the cheek. As the doctor will pull out the cheek, we're going to place that right in. And as a new assistant, you may not feel comfortable yet just placing those, so the doctor sometimes will do it, or will hand the cotton roll to the dentist on a cotton plier and pass that to the doctor. And here, when we're utilizing a cotton roll on the maxillary arch, we're going to place it between the cheek and the side of the teeth that we're going to be using, and then also right underneath that fold. For the mandibular arch, you're going to see that we're going to again place it between the cheek and also right underneath the tongue. Anytime we're on the mandibular arch, we really want to put it underneath the tongue and really push that tongue back, because what that's going to do is allow us to even have a resting place, which I'll show you a little bit later. For the mandibular anterior section, we're going to place it between, again, right between the cheek, and we're going to make sure, and you always just have to remind yourself, I'm going to pull that cheek away. What's the best way to do that? Utilize cotton rolls. And then we're going to place it right underneath the tongue, because that's where a lot of saliva pull will take place. And again, very easy to utilize cotton rolls in the oral cavity for saliva control. The next item that you're going to see, now some practices have these. I will tell you, when I changed practices, the doctor that I was working with didn't use these. They only used them in hygiene for sealants and some of the other procedures that we were being done at the time. But I will tell you that some practices will. And a dry shield is basically, or a dry angle. There's same thing. It basically is an isolation device, and it's triangular shaped. They're all different types. There's some that have a reflective shield, and some that are color-coded. And I like these that are color-coded. The one thing about the color coding is that coating is always going to go to the cheek side, so it really makes it easy for you to know how to place it. The other thing is it's kind of shaped like an arrow. So what you would think about is a bow and arrow. That arrow is going to be shaped towards the patient's mouth and going into their oral cavity. And the colored side is always going to be on the cheek side. And so as we place it, we're going to place it right in between the cheek and the tooth. And we want to make sure that the pad is always, against the colored side is always against the cheek. Now, when we place that, one of the things that we always want to make sure that you understand, though, is that as that is being placed, again, that absorbent pad is going to be placed right over the salivary gland, right over the gland duct on the opposite maxillary second molar area. Once we finish utilizing this dry angle or dry shield, we never want to just grab it and pull it out of the patient's mouth, because one of the things that I will tell you is that this is going to keep the area dry, and it basically almost bonds to the inside of the cheek area. And so if you grab it without wetting it and letting it release on its own, you can actually pull some tissue off of the patient and actually cause some irritation there. So just make sure that you're adding water before you remove it. The first thing that we want to talk about today could be a nightmare for you and your practice. And this is something right now in this day and age that nobody really is utilizing anymore. So I want to make you aware of it, though, just in case you do work in a practice where the doctor is taking a 2x2 and opening it up and placing it in the back of the patient's throat to help avoid suctioning, or not suctioning, but hopefully avoiding any aspiration. But one of the things that has happened over the last 2 years is that we've had patients, not in my own practice, but now have emergencies where patients have actually swallowed the 2x2. And so one of the things we always want to make sure of is if your doctor is utilizing this type of procedure and utilizing 2x2s, which is a gauze, you always want to wrap some floss around it and ligate it and tie it in a knot. So this way, if the patient does swallow it, you can grab it quickly and pull it out. I personally don't like this technique because there have been patients who have passed away, unfortunately. So again, I feel it's a danger and I don't like to utilize it. That's where I like to use a rubber dam or a different product called the Throat Shield. And this is a product from Zerk. It's a very, very good product. It's different sizes. And what I like about it is you'll notice there's holes on either side where you can ligate a piece of floss, tied it in a knot. So if you're worried, and a lot of times this is utilized in oral surgery or even implant placement, that aspiration just will not happen because of the fact that we've got that floss attached to it. And again, this will keep the patient from aspirating and swallowing those devices. Now, the next thing we want to talk about is bite blocks, and there's all different types of bite blocks. There's some that are disposable and some that are rubber where we can autoclave them. A dental bite block is really utilized to help keep the patient's bite open. Now, for some of those elderly patients, they really like this because they can rest on it. Because if you're doing lengthy procedures, and I know because I've had a lot of long procedures done on myself, a lot of times my jaw will start moving around because it gets tired. And so this helps the patient to really relax. But the downside of this is I also have a bad disc in my joint. So you got to be really careful with these long-term bite blocks. But, for shorter time frames, I think sometimes this is good, but a lot of dentists like to utilize these. And so again, they come in different sizes. It also helps, I think, sometimes for a young adult or a young patient not to bite down on the handpiece, which also is great. So we want to make sure that you also, again, are familiarized with those in case that is something that you're going to be utilizing in your practice. Now, let's get to it. Let's talk about saliva ejectors and HVEs, and you'll really be able to identify these very, very easily. The saliva ejector is very small and comes in different colors, as you'll see here. The HVE is always going to go on the larger suction, and then, like I said, the saliva ejector is always going to be on the smaller end. And we're going to start today by talking about the saliva ejector. The saliva ejector is a tiny suction that goes into the smaller tube. It's a low volume evacuation system that is flexible. It's a plastic tube. It's about 1/3 the size of the high volume suction and utilized a lot of times in hygiene, but also utilized by the dental assistant between the tongue and the teeth, or between the cheek and the mandibular teeth. And one of the things that I want you to be aware of, though, is the fact that this has little cut areas because it's cut by a machine that can pull the tissue and sometimes cut that in the patient's mouth. So you got to be careful with it. It's never used for high volume evacuation. It's going to be utilized when we're just quickly removing any, slower end or lesser pool of saliva, which I'm going to demonstrate here. As we're taking a final impression, you'll see that I'm going to be going in the patient's mouth here with the saliva ejector, just to kind of quickly remove any saliva and just kind of drying the teeth just a little bit as the doctor is taking a final impression. We never want to utilize this when there's a lot of water coming out of the handpiece. Okay, it's just for something to quickly evacuate any saliva pool or any saliva that's in the patient's mouth. And again, let's start now with the second area, which is the high volume. And this is going to be our best friend. This is what we utilize 99% of the day, is utilizing the high volume suction. And when we're utilizing this high volume suction, we're going to use tips that are also referred to as aspirating tips, but we call them high volume or HVE. And again, they're used to suck out the saliva or any debris in the patient's mouth during restorative or any type of procedure. For a right-handed dentist, we're going to place this saliva ejector in the left hand, and in anytime we're utilizing that, we want to make sure that we are, making sure that we take really good care of where that's going to be. And again, utilizing whatever hand you're going to be in. Now, you see the doctor who is a right-handed dentist. The assistant is going to be utilizing the high volume suction in their right hand. And again, if this order is reversed, that dentist is likely to be obstructed. So we want to make sure that we're always retracting the lips and the finger or the tips of the HVE to get that in position. And the dentist may then position the mirror and then the handpiece. So let's back up just a little bit and review that again. When utilizing the high volume suction, the dentist or the dental assistant is always going to be placing that suction in the mouth first. And when I say that, we're the ones that always go in first, not the dentist, okay? So we always have that air water because I'm right-handed. In my left hand is going to be the air water syringe. My right hand is going to be the HVE. And again, we're going to make sure that we are in and retracting things out of the way for the doctor to come in with their mirror and either an instrument or coming in with the hand piece. And that tip of that aspirator or HVE should never contact the patient's soft tissues. But listen, let's be honest here. As a new assistant, I can't tell you how many times I've sucked up a patient's tongue or cheek. And even right now, if I were to go in and a patient is one of those that has that tongue that is like a wild animal, it's going to happen. And I'd be lying to you if I told you in my time I have never sucked up a cotton roll, because listen, I have. I'd be lying to you. So it happens. And again, you're going to find your way. But one of the things I want to help you with today is giving you some ideas of some really good HVE retraction devices to utilize so this doesn't happen to you and makes your life just a little bit easier. But before we do that, let's talk about the grasp of utilizing the HVE. And this is probably the most important thing that we need to understand. There are three different types of grasping, but the two that we're going to utilize the most is called the reverse palm thumb grasp or the modified pin grasp. And I will say that most of the time as a dental assistant, we're going to be utilizing the pin grasp. But one of the things I want you to understand is that suction tip has a hole in it, and it's always going to have this little bevel that faces always towards the teeth. Now, when we're following these guidelines, we want to gently place the high volume tip in the patient's mouth. Avoid any bumping of the teeth, lips, or gingiva. But again, we're human. When you become a new dental assistant, this is going to happen, okay? You never want to place the suction down in the middle of the patient's mouth, though. You always want to aim towards the corner, right behind that last molar. You see where my suction tip is, right? It's the first molar, second molar area, because if you stick it down the middle of the patient's throat, they're going to start gagging and they're going to choke. And guess what that happens? It makes the doctor aware, and it kind of makes the doctor look at us and roll their eyes, right? But again, we're human. But if you always aim that suction to the corner of the mouth, this won't happen, okay? So try not to do that, because if you go straight down the center, they're going to gag, okay? Anytime you're touching the center of that patient's tongue, that's what's going to happen. We also don't want to touch any instruments that belong to the dentist or the handpiece, because if you bump it, the doctor could hit the tooth and cut the tooth, or worse, cut the patient's tongue, all right? So position that suction so that it does not obstruct the dentist's view and the mirror, and we'll talk more about that a little bit later. The HVE should always be placed on the opposite side of the handpiece as well, and we're going to take you through that, okay? Because practice makes perfect. We're going to place that tip in the patient's mouth and position it before, again, the dentist gets in there, right? You're going to go first and place in the HVE tip approximately one tooth distal to wherever that area is going to be exposed. Now, again, holding the bevel where we talked about, which I'm going to show you here in a minute. And the middle of the HVE opening should be even with the occlusal surface. That's something to think about. When you look here at this photo, you see where my suction tip is, right? I'm looking at the pointed bottom of it. You see we're on the bottom, but think about that hole, and the top of that opening, the very top of the suction tip, should be even with the occlusal surface, okay? That will save you every time. Position that tip the far enough away back from the handpiece so that it doesn't draw the water coolant away from the burr too, okay? So you're going to rest that HVE, though. That's the beauty of using cotton rolls. If you put a cotton roll between that patient's tongue and those teeth, you can rest on it, which is the best thing to do, okay? Because as a new assistant, it's going to make your life so much easier, okay? Always avoid placing that HVE tip on the soft palate, and we're going to talk about that here in a minute. As you see, when we're going to place that high volume suction in the maxillary quadrant, up on the maxillary area, whether it be right or left, we want to, again, make sure that we're not touching the soft palate, because let me tell you, that can also cause the patient to gag, okay? And we don't want to touch any of that tissue. Keep the HVA tip far enough away from any mucosa or tissue to prevent it from being sucked into the tip, okay? And when it does, it's going to make a loud noise. And sometimes the doctor can jump, the patient can jump, and guess who else is going to jump? You, okay? So looking at the palm thumb grasp, pin grasp, all right? We got to practice here. So let's talk about the high volume and where we're going to be placing it for the maxillary right quadrant. You see here, again, you're going to see this over and over and over. And I would say if you get this down, everything else is a piece of cake. It's all going to go up from here, okay? But if you don't get this down, guess where it's going to go? Downhill from here, okay? It's not that hard. And one of the things that I'm going to do for you is give you a download and a diagram. Take it to Kinko's, take it somewhere, print it out, laminate it, and memorize it, okay? For the maxillary right quadrant, if that patient is looking out to you, or if you are behind the patient, that's their right, okay? So the upper right quadrant, the dentist is going to be up here prepping that upper right molar, and your suction is going to go right on the lingual side, right into the palate there, right up close to the tooth. And we always want to try to keep that suction really not too far back, because I told you what's going to happen. The patient's going to get choked, right? We talked about that. So if you stay in that first molar lingual area, you're golden, okay? So we're going to place the tip near the lingual surface, really just distal to the tooth that we're going to be working on, but I think it's safe to stay in that first molar area, okay? And again, making sure that bevel of that tip is parallel to that lingual surface of those teeth, okay? And notice that this tip is resting on the maxillary teeth and that maxillary second quadrant. So we want to kind of stay in that area, okay? And again, I don't like to have it right on the tooth. I'll just be honest. I have it just slightly away, a little bit less than an inch away, so I can jump in there really quickly and come out. If the patient has a lot of saliva, I can quickly put it closer in and come right back out. Put it closer in and come back out. Now, let's go to the maxillary left quadrant, okay? We know there's no way for us to get that suction on the lingual side. We have to go to the facial. It makes sense. Use your brain and think about where are you going to be, okay? Because if that handpiece is in one area, all you got to do is think about yourself, I can't get in there on the lingual side. It's obvious, because if I do, I'm going to hit that handpiece. So I am going to have common sense here and know that I'm going to be in that maxillary left quadrant. I'm going to be on the cheek side, right? I'm going to be on the cheek side. So I'm going to be pulling that cheek area out and making sure that I know I'm going to be on that maxillary left quadrant, and I'm going to be on the inside of that cheek. Here, this example, they're using their finger to pull the cheek back. Now, I will tell you, I don't do that. I utilize my air water syringe because I don't want to have to put it down. If the doctor has a mirror here, how are you going to keep the mirror clean? You're not going to be able to do that if your finger is in the patient's mouth, right? Because you can't hold your finger, have your finger and hold the air water syringe. So I like to use the tip of the air water syringe. And so I'll actually retract with that, which I'll show you here in a minute. Okay. So again, looking at the bevel, always faces the teeth. You see where I am. If you keep that tip in that first molar area, you'll be golden. And then again, as you get more experience, it's going to come so easy. It's like riding a bike, I promise. Okay, so now let's get down to the mandibular arch. We're going to start on this left quadrant here. And again, we're retracting. See, again, they got that finger in there. I don't like to use that finger, but I do want to use an air water syringe. Again, I'm going to pull the cheek out. Now, this is where, as well, you can put a cotton roll. Again, utilizing a cotton roll is just that extra protection. I could rest my suction on that. The doctor knows that we can put one on right underneath the tongue where he's prepping, but sometimes if that cotton roll is on that in between the tongue and the up against that area where they're preparing on the lingual side, they can sometimes nick that with the burr, and again, the patient's going to jump because it's going to really nick the cotton roll. The good news is it didn't cut the patient's tongue, but if that does hit the cotton roll, everybody's going to jump, right? So some doctors don't use cotton rolls on the lingual side, but again, if the patient is not one of those where the tongue is moving like a wild animal, you can have them lift their tongue and put that cotton roll right underneath the tongue, and it kind of keeps that tongue from moving. So again, you'll find your way. Don't beat yourself up, and just knowing where you need to place the suction. Once you know that, it's going to get easier and easier. I promise. All of us have been there. So let's talk about those areas that we didn't go through. Again, on the facial side, let's talk about the canine area on the upper arch, okay? Regardless if you're on the upper right canine or the upper left canine, see here where my suction is? I'm right behind it, or really in that premolar area is safe. You could even go back to the first molar if you wanted to, just to make sure that you familiarize yourself, but most importantly, get, used to that being in that area. But you can come forward. One of the things that's really important is just not being in the doctor's view, okay? So you can see where it is. If he's going to come to the on the incisal edge or towards the lingual, of course, I'm going to move back a little bit more because most of the time when they're in that area, they're going to put the mirror in, right? And they're going to move up to that 11, 12 o'clock position. So they're going to be up and over, and I want to make sure that my suction does not cross over the mirror ever. And we'll talk about that here in just a minute. If they're working on the 8 and 9 area, or the 1s, for those that are in Canada, that suction is going to go right behind those front 2 teeth. You see where it is? is. And on the mandibular arch or the lower arch, guess where my suction is? Right behind 22, 23, 24, and 25, right? I'm going to be just kind of going back and forth in that area. But again, if there's a cotton roll there, you really can rest on it. Just make sure you don't suck it up, all right? So now when we're looking on our doctor's working on the mandibular left quadrant, you see where my suction is, right? My goal always as a dental assistant, your role is to pull that cheek out of the way so the doctor can get the handpiece in and not cut the cheek, not cut the tissues. And our job is to protect that patient's lip, mouth, and tongue from that burr, okay? So just making sure that you familiarize yourself with these areas. And again, it's all repetition, right? Now, when the dentist is preparing a tooth, we always want to make sure that, we're keeping everything clean, keeping the dust from flying everywhere. But the biggest mistake we make as a dental assistant is leaving the mouth when the dentist is still in it. Never, ever leave the mouth while the doctor is still in. And always only getting in there really quickly if you need to when the doctor leaves. The other thing is that the dental assistant could then take over the mouth when the doctor leaves so we can rinse and wash everything really great, keeping everything nice and clean, but most importantly, getting rid of that tooth dust or any fluid, saliva, anything that's on those preparation sites so the doctor can come back in with a fresh set of eyes, okay? Now, let's look at some video here. So you'll notice here what I'm doing.
Okay, so let's go ahead and do our
And I'm just going to turn his voice down so I can talk over it. But here, let's familiarize ourselves here with exactly what the doctor is doing. So he's preparing the teeth, and you see where my suction is. I'm utilizing a high volume suction, and really, again, looking at where you are and just sucking that, that water that's coming out. Let's look at another video here, how close we are. And again, getting in there, getting everything out, rinsing it really good. You see I'm going in there with a full swoop. If you're using a retracted device or any type of retractor going up underneath there, just getting rid of any tooth dust fast, right? Because he doesn't have a handpiece. He went out. Now he's checking, some other things. And I want to make sure I'm getting in and out, rinsing quickly. Again, nothing is in the way. Keeping everything nice and dry. There's a little pool of saliva back there. And I may, at this point, since he's checking reduction or things like that, get in there with a quick saliva ejector. But again, look at where I am. Not obstructing his view. You see, that's my air water, giving little short blasts of water, keeping it clean, keeping his handpiece clean. You say, Shannon, really, you're keeping the handpiece clean? Yeah, I am. I want the burr to be clean. I want the handpiece to be clean. And most importantly, keeping those little teeth, little dust off the patient's tongue. Because that's my job, is for everything to be perfect, clean, and clear. All right? Now, this is where we got to get used to using the air water syringes. And listen, every practice air water syringe is different. Every piece of equipment is different. So you got to practice. When you go into that office, if I taught you today how to use the air water syringe in my office and then you went to a different office, they're all different. The pressure is different. The air is different. The water is different. Trust me. So one of the things you want to get used to is how much air is going to be coming out of that air water syringe, how much water, and then what happens if you push the button and you're going to use both. And you saw I was doing quick blast of both, right? So the air water syringe can be used to clean the mirror most of the time, help with the fog, using air. That's what we would do, because the air is going to remove the fog and remove the water. But if there's dust on the doctor's mirror or on the teeth, I want to get rid of all of that really quickly. So I'm going to use even amounts of air and water to get it away, right? Any blood or saliva, same thing. When you use blast of air and water, it makes common sense. It's going to remove everything really, really fast. But sometimes we don't need that much air on full blast, which is why I'm going to give like little light splits of air, okay? And so the air water syringe is really connected to the dental unit, and it's going to provide air and water, and sometimes, like I said, that combination, okay? And one of the things we want to do is we still want that direct syringe tip towards the tooth, but making sure that anytime the dentist is working, that we're continuously keeping things clean and making sure that we're paying attention to the back of the mouth, and anytime the dentist is pausing, that we're going to rinse and dry the site, okay? Just like here, let's demonstrate and show you when the doctor has got the mirror in, I'm rinsing the mirror off, I'm rinsing the site, I'm keeping things nice and dry, because if he can't see, and I can't see in the mirror, then I know he can't, right? So I want to make sure of that. You see that I'm constantly drying, rinsing, quick bursts of air and water at the same time, and suctioning. You see that? Just keeping everything nice and dry. I'm constantly going in. If you're a new assistant and you keep that mouth clean and you keep that air in there and keeping that mirror clean, everything else will fall into place. I promise. Okay? You see, quickly rinsing, drying, wiping the mirror off. Now watch me. You see here, I'm going to go straight to that mirror because he's always holding that in the left hand if he's a right-handed dentist. What did I do? I wiped that mirror. Let me back up a little bit. I want you to see that again, okay? Look what I did. You see me? I'm coming back. I'm going to wipe that mirror real quick. Watch. You see it? You didn't even see it, right? You got that? It was so fast. These things are going to come. It's almost like you guys are, you're doing a dance, right? You're doing a dance.
Let's hit the edge.
See?
Now.
Getting in there, getting out, all right? Now, let's look at what we call the full mouth rinse. That was just quickly getting in there fast, but watch this full mouth rinse, okay? We're getting ready to take a final impression. You see here, we're rinsing really, really good. We're drying really good. You don't see any debris. Let's do that again. No debris. Full mouth rinsing is when we're going to use the patient's entire mouth, rinsing everything out of the way before we take a final impression. And again, you're going to find your way. Don't beat yourself up. Now, there are special tips that we can utilize. This is one that's my favorite. This is called the Safe Vac. The Safe Vac is an HVE, high volume suction, that has a little rubber feet to it. It also has a little tiny, what we call little screen inside. And I love these. The one thing about having the little rubber feet on the end is that you won't suck up the patient's tongue, but most importantly, you won't cut the teeth. Or cut the tissue. Let me show you how we utilize that there. And then now we're going to move on to what we call the lingual guard. And this is a little device that fits onto the high volume suction. It's these are I hate to say they're the cheaper end suctions, but this little device, it just goes on the end of those. And so most practices are utilizing just the white simple suction, but this little device is kind of a little guide. It's an add-on, is what I would call it, and it retracts the tongue. Watch this. So one of the things that's great about it here is you'll see that we are retracting the tongue with it. We're able to remove the saliva and the water from the doctor's handpiece. And it just fits on the end. This is from Colzer. It's called the Ivory Lingual Guard. It's a really nice little device because you see here I'm able to push the patient's tongue back and remove the saliva at the same time, especially if you work in a practice that doesn't allow you to have those other Safe Vac retracted HVE devices, right? So, because we know that a lot of times price is something that we have to really be considerate of. But again, these little devices are really nice. Now, let me give you another scenario here. You can see that it's a suction device with just that little end. Again, it's an add-on. Notice here in this video, I'll show you. Let me go back here again with it, is that I am utilizing that little area as Dr. Milner. He's a left-handed dentist and he is prepping number 8, and so I'm actually going to not be in his way because we're utilizing another suction device and we're using a cotton roll, right? It's like, hey, 3 in 1. So sometimes, depending on the dentist, Dr. Milner likes to use a relief, he likes to use the lingual guard, and he likes to use a cotton roll, okay? He wants everything nice and isolated. All dentists are different, okay? You got to ask them what they like to use when you start, so this way you can familiarize yourself. This is another system called the PureVac. It's another HVE system. This is from Dent Supply Sorona. This is really great system. My hygienist loves this. It has a mirror on the end, so anytime they're utilizing the ultrasonic, they like to use this. You'll see that it really has a little mirror on the end. For me, I still like to use the standard, but this is a great little device. I also want to share with you some other relief. This is called the relief and other devices similar to the dry angle, but this actually fits on a suction. And what it is basically the little leaf fits into the cheek just like the dry angle does. It goes on the high volume suction. My hygienist loves this. It can be utilized anytime they're using a ProfiJet or an air polisher, any type of ultrasonic device here. And again, I'll use this if I'm doing sealants. Sometimes we'll utilize it if we're doing a root canal. or for those practices that don't like to place a rubber dam, it's a really, really cool device, and a lot of people really love it. And then when you're finished, you just throw away that little green leaf and you put the tubes into the autoclave. It's a great little device. Now, let's talk about some other areas of retraction. We have here a lot of people like to utilize this little device. It's called the Optrogate, and then we'll get to the other device, which is on the left here right after that. The Optrogate is a device that, and I'm just kind of skip through it really quickly. And I'm going to talk over it. So you'll hear me here. This is called the Optrogate. This is from Ivoclar Vivadent, and this happens to be my daughter Haley. So you may be wondering, why didn't I put glasses on her? Well, we were just doing a demonstration for you. When you open this up, you'll see here exactly how to place it.
Just kind of slip this in, and basically just relax. Just going to slip in like that. Just going to slip in like that. And we're going to slip this side in. And we're going to slip this side in. And it's going to kind of go up. There we go. And bring your teeth together. And it's going to kind of go just up, like that. And close just a hair. Just like that. And you can kind of pull it. So if you're taking photographs, if we're doing some bonding, we did some bonding on one of Haley's front teeth. It really works really well. And just kind of open and close just a little bit. Does that feel pretty comfortable to you? Yeah. And this is called the Optrogate Junior. And again, comes in regular and small. Most patients are smalls, but we also have some patients that are juniors.
And we really like that. So here you can see in the video, we're utilizing that for our procedure and preparation. And again, it's just like a little balloon, but you see how it's able to keep the lip off of those teeth and really have those retracted lips all the way around. And that's one of the things that's great about this Optrogate is everything all the way around is protected. And the one thing that I will tell you is, when we get into our bleaching module, I don't like to use this for in-office bleaching. Some people like to utilize it for that, but I don't think it's safe. And I really only want to utilize this for direct and indirect procedures. Notice where I've got my air water and I'm holding the suction in my right hand. I'm constantly going in and out. You see where I am. I will go wherever I possibly can sometimes. This is called the Tipadilly. It's basically a curved suction, and this is a great option for those of you that are especially new assistants. But you see I'm holding that air water syringe. I'm higher than the dentist, although he is sitting up a little bit higher. Dr. Cranham is here in this video because he likes to use a scope. But my job is to keep everything nice and clean, right? But I never go over into his vision, okay? Now, let's talk really quickly about the next isolation device that we're going to go into. This is called an IsoDry. We also have Mr. Thirsty. There's IsoVax and IsoLights. Lots of ISOs here. This Mr. Thirsty is disposable. That's at the top. And then the other one, the IsoLight, IsoVac, and IsoDry, they have a light device that is included. Now, the Mr. Thirsty is a lot less expensive, but again, it doesn't have a light. So that's one of the things that, in some practices, they would not want to pay the kind of money that we have for the IsoLight. But again, it's disposable. Let me show you here how it's used. It fits onto your high volume suction. It does have a bite block, which is really nice. And again, goes to the back of the patient's throat and just behind the last molar. And let me show you, just kind of push it back. You'll see here. And then again, the patient can bite on it. Comes in different sizes. And we have the full video after the module, so you can kind of watch at your pleasure. If you really want to spend some time looking at each one of those, we have put in the full video. But here you can see where it can suck up a whole lot of water. And we can just imagine that being saliva works really nicely. So again, so many options, right? You're like, oh my gosh, how do I know what to utilize? Really is a conversation for you to have with your dentist, and you both decide, okay? Now, the last thing we want to talk about is a new product that came out over the last year called the ScanMate. And the ScanMate can be utilized for a lot of different procedures. To me, it's almost like a baby spoon. We use it a lot when we're doing scanning. It really just helps pull the cheek out of the way instead of utilizing a mirror. It's rubber, so it's really smooth and most importantly, very comfortable for the patient. And some people actually like this device. So again, another retracted device that could be utilized in dentistry for you and just making sure that we keep everything out of the way, right? Now, I want to thank you for spending the time with us on this module. This is probably the most important module of all, and I mean that wholeheartedly. I didn't want to put in there a whole bunch of fluff. I want it to be very practical for you and for you to be able to utilize quick ideas and information. Excellent chairside assisting really requires us to have knowledge of not only equipment and materials, but most importantly, efficiency. And that's what's going to have to be done first. You have to know how to suction the materials of what you're going to utilize to keep that mouth clear of debris and saliva, and taking really good care of the patient is the number one job of us, the dental assistant. So now let's move on to some dental instruments and talk more about our role at the chair as a chairside assistant.